Nobody wakes up in the morning thinking, I'm going to go to A&E today. Nobody knows. Nobody knows who it's going to be.
Paediatric trauma call, 15 minutes.
Code red, helipad response.
You're having a heart attack.
We want to be in and out of scan in the next 10 minutes.
I can't feel any pulse.
Any reception, can I help you? Yeah, 24 hours, 7 days a week. I love that question. What's your opening hours?
St George's, London. One of the busiest and most advanced A&E departments in the world.
Beautiful. It's as if we've done it before.
We are there when awful things happen to pick up the pieces.
We have a 2-year-old who's kicked like a horse.
We see the unpredictableness of what happens in life, and we're suddenly having to explain why it's gone wrong.
I can't feel my left leg.
You'll be okay.
A place where life
A&E selfie!
Down below. Too slow.
love
Such a good boy. So proud of you.
and loss
I'm still here.
unfold every single day.
So we don't shake hands at this hospital, we fist bump. Can I have a fist bump?
All the patients you're about to see were treated in just one 24-hour period.
Hello, darling.
You genuinely do see the best of people in this job. You'll see strangers rushing to the aid of someone they've never met. You just see things that make you realise just how important the people in your life are and the people around you are.
Right. How things, my brother? Greetings, man.
Really shouldn't have become dependent on caffeine again.
Trust me, it's an early night.
See, the problem is, Narani, you're looking at it as an intelligent, rational person. You mustn't do that. That was the mistake I made.
Dr. Arash is a trauma and orthopedics registrar.
Oh my God, you're brave.
He's worked at St George's for nearly 2 years.
I cannot stand rotors anymore. I just can't.
I was born in Iran, and when I was about 5 years old, because of the war, my parents moved to London, and that's where I've spent most of my life.
Yeah, that's like a big offence in my book.
My parents had both trained as nuclear physicists, and they had to leave those jobs when we came over here, but it's not the sort of thing you can turn up in another country and just say, I'm a nuclear physicist from Iran, have you got a job going?
Oh.
Well, that's my horse bit me.
Your horse?
Isn't it? Yeah, I was thinking, what the hell did happen there?
Is that how you get to work?
To have to go back and rebuild and start a completely different job in a different country with no family and friends, I think for any of us that would be terrifying. And I have a huge respect for them, and they had obviously had a huge influence on who I've become.
2 thumbs, 2 femurs. It's one of our favourite numbers.
The orthopaedic jokes are
endless. We never get tired of it.
I remember growing up always kind of wanting to do medicine. I do like the problem-solving part of it, and I wanted the challenge.
Oh, Christine, you're only the second best nurse. Oh, that's not Christine, that's why.
It's Claire.
Because every day is different, every patient's different. You never know when something's going to push you to your max.
Are there any trauma calls on the way in? Good. I might go and put some food in the microwave. I'm starving.
St George's Resus. Trauma. 52-year-old male. Yep, perfect. Thank you. Bye.
A 52-year-old man is being airlifted 30 miles from Kent, where he was accidentally hit in the face with a golf club.
Unknown male trauma in 15 minutes. Let me put a helipad for.
Whenever you know someone's coming by helicopter, you already know they're coming because it's time critical. So in those cases, you know that every second counts, every second is critical, and you really don't get a second chance.
He's been hit in the face with a golf club, loss of consciousness, seizures, they've RSI'd him, got a blown pupil, they've given hypertonic, and they'll be here.
Perfect.
Golf isn't typically known for being a highly dangerous sport that brings people to accident emergency.
Can I have an adult trauma call to A&E resus?
But particularly if he's struck in the head with the golf club, what you worry about is obviously the force of that. Imagine how far you can hit a golf ball and what that can do to the contents of your skull.
Hi, switch, helipad response team, all in position. Could the nurse in charge come to resus, please?
Doctors at the scene suspect a critical head injury, so will take the patient straight to CT.
Time is brain. Those tissues are very sensitive. You're losing potential function and potential reversibility every second that passes.
John's wife, Alison, is travelling to St George's by road.
I was in work. I got a phone call from my son, Ben, saying that there'd been an incident at the golf course. They was on the 18th tee and his friend had a bad shot, and in anger he threw his club up in the air. John was like several paces behind, but obviously as he's thrown it, it's gone at an angle and it's come back and it's just whacked, flown across and hit John straight across the face. I didn't realise how serious things were. I had loads to do that day. We were supposed to be going to a dinner and dance, and I needed to take my dress to get it altered, and I was thinking, oh my God, I can't believe I've got to go up the golf course, thinking that he's probably just needs a couple of stitches.
And my count 3, 1, 2, 3.
The golf club actually hit John with such force across his face that it snapped.
Again, your call at the top end.
John was intubated at the scene to minimise the risk of brain damage.
This is John. He's 52 years old. Approximately 2 hours ago, he was struck across the face with a golf club and fell onto grass. Loss of consciousness was reported for 3 minutes with a generalised tonic-clonic seizure afterwards. Pupils on the right is 7, unreactive, left is 2, reactive.
Thank you very much. Okay, could you undo the scoop at the top and bottom, please? 3 people on the patient's left.
When I got there, John was lying on the floor, there was blood everywhere, the paramedics were all round him.
Could we brace from the patient's right-hand side, please?
1, 2, 3.
The guy that actually hit John with his club, he was having a meltdown, so the paramedics were then seeing to him.
1, 2, 3.
Perfect.
And I just went into, I can only say it was shock.
Okay, team, this is a critical head injury. We need to move out ASAP.
You got some sats?
Haven't got heart.
We're not ventilated yet.
We've got 45 seconds to do a primary survey.
24 to the teeth.
I just blocked everything out, I think. I just took everything in that they were saying to me.
Okay, air entry equal bilaterally. Tommy is soft and not distended.
Okay, you've got 20 seconds left.
I don't think anyone could prepare you for what we had to go through.
Ready, steady, slide.
Okay, everyone out. 5, 4, 3, 2, 1.
no surgical emphysema, no. Blood pressure, 141/86.
It's been 12 minutes since 52-year-old John arrived at St George's after sustaining a critical head injury on the golf course.
Air entry was fine. There's no clinical fail.
Doctors have taken him straight to CT to look for any damage to his brain.
141/86.
Me and John have been together 31 years now. I met him when I was 17. We was actually on an 18s to 30s holiday. So in Ibiza, I'd gone away with a friend and he was away with his cousin.
Okay, all finished. Thank you very much.
We went to like a rodeo show and he was trying to impress me and he got on one of the bucking balls. So he was on that and he was like thrown off straight away.
So he's got 2 millimetres pupil on the left and then 8 millimetres on the right, neither of them responsive.
You know, he was like a young firefighter then, so he was a bit bolshy and that. So, and he was interesting and, yeah, he was just totally different. And I don't know, we just hit it off straight away. And it's like I'd known him for like years.
Okay, can the coordinator move over, please?
Just from the minute I first met him, I just knew he was going to be the one.
Again, slide. Ready, steady, slide.
Okay, we're going to cubicle resus 1, please.
John is being moved to resus, where doctors will now continue to stabilise him.
Okay, can you get a chest and pelvis?
That time when you're waiting for a scan or a scan report, there is that trepidation. There's nothing you can do, you can't speed that process up.
36.6 the temperature.
Okay, can we...
In his case, what you're immediately expecting is evidence of a head injury with a bleed. For a closed head injury, what you worry about is there's nowhere for that bleeding, if it's occurring, to go. And therefore the pressure builds up and the bleeding then pushes on the brain and stops the blood supply getting in.
Could you get 20 mils of saline for me? And then would you kindly open the catheter bag and just drop onto there for me?
Time is critical.
Can you grab me out a vial of adrenaline, 1 in 1,000? Thank you very much.
There's a huge weight on your shoulders.
I'm going. What do go on?
My name's Craig. I'm going to look after you. So what have you done?
I haven't had the nerve to have a look at it.
Don't worry, Jackie. Sit down.
I am, love.
We'll do it. Don't you worry about that. Cheek of you.
Radford, please. Radford.
I'll go in his place. I'll go in his place.
77-year-old Joan has come to A&E after falling down the stairs at home.
Excuse me, have you got no idea how much longer I've been?
What's your surname?
Phillips.
Phillips.
Yeah, Joan Phillips. I just love hospitals. I could stay in there all day long. I just love hospitals.
Someone's just clicked on your name, so they'll be calling you through any minute now.
Oh, will they? It's down that end, yeah? Oh, lovely, thank you. I worked at the hospital in the theatres, and I loved it in there. It was only a cleaning job, mind you. Some of the trays that come out, you know, you'd see half a leg in there or an arm in there. I'm afraid it is the gorier, the better.
Joan Phillips?
Some people probably think I'm sadistic, but I'm not really. Oh, I don't think I am.
So what's happened to you?
Well, It's silly, really. I went down the flight of stairs early in the morning when I got up, and I went down all those camp stairs, and I thought, oh, I've only got one more to go.
And you slipped on the last one. Is there any past medical history I need to know about, like asthma or diabetes, blood pressure problems?
Blood pressure I've got.
So you've got hypertension.
Yeah.
And you're not allergic to anything that you know of?
No, I'm not allergic to nothing. Only stairs and things like that.
Whereabouts are you getting most of the pain?
All here, up the back here. Come from Camberwell. 16 children my mum had. We'll slide down the banisters next time. I'm not going to walk down the stairs. And she was the eldest of 22, my mum. 22 children. It's like a monkey's foot, doesn't it? 3-bedroom flat. That's what we lived in. Ever so clever, aren't I?
You are?
I think there was 5 of us in one bed. You know, some at the top and some down the bottom. It was exciting because we used to lark and muck about, and my mum used to say, if you don't get asleep, you lot up there, I'll be up there after you.
OK, and do you smoke?
Yeah.
How many a day?
Roughly about 15, although I'm trying to stop smoke at this minute.
How long have you done that for?
I'm not going to tell you because you won't believe it. My brother, he gave me the cigarettes. Or I made him give them to me, should I say.
50 years?
10.
67 years. Wow.
He used to nick them out of my brother's case. Not a lot. He used to just take a packet out. And I said, if you don't give me some of them, I'm going to tell him.
And you're going to try and stop, are you?
Oh, yeah, yeah.
OK.
I'm always trying to stop.
All right, let's have a look at your ankle. Wow, it's nice and bruised. Can you feel me touching you?
Hey?
Can you feel me touching
you?
you?
Yeah.
Is it painful up here?
No. No. No.
Did you feel that?
What? I'd love to go back to the young days, actually.
Why did your mum and dad have so many children?
I don't, we just put it down so there weren't no television.
It did make a bit of a noise then when I moved it.
What's that mean?
It means you might have broken it.
Yeah?
Joan, they'll x-ray you and then I'll bring you back to me, OK?
All right, love, thank you. And you'll tell me if I've broken things.
Oh, I will.
BM is fine, pH is fine, CO2 is 20. How much oxygen are we on?
It's been 22 minutes since John arrived at St George's after a golf club lacerated his face.
So the right is a 7 and not really reacting very well. Not at all, it's not. 2 and reacting.
Doctors are concerned that his right eye isn't reacting as it should.
So it's just possible that he had a response to the head injury, and maybe he's got a small subarachnoid or something that we haven't seen yet.
When people have head injuries, one of the things we look at is the response of the pupils, which are the bit in the eye that you see that moves when it gets lighter or darker. So even in people that are unconscious, you expect this reflex to occur. So when there isn't a response, then you worry about what the cause of that is, and is there a serious head or eye injury causing that?
Okay, can everyone stand out for X-ray, please? Thank you very much.
Doctors will now take X-rays and do further tests to assess the severity of John's head and eye injuries.
Okay, can we keep him warm?
Whenever people have critical injuries, and particularly if the risks are high for treatment, then it's even more important to understand the person as a whole and not just their injury, because you have to think about what's happened to them on this day and what's happened to them coming up to that day and in their lives, and what are their chances of recovery and what's their chance for rehabilitation.
Soak this with gauze and stick it on a wound that he's got in between his eyes. It's going to vasoconstrict locally and stop the bleeding.
John was in the fire brigade for 32 years. He loved the adrenaline. He loved what was going to happen next, the excitement of everything, the bells going, like them jumping on the engine.
I should have the blood labels on the side there.
So much has happened to him, like he's fallen down staircases and went to like the bombings in London. You know, obviously he saw such horrific things. To him, it's part of his job, his life. That's what it was, that's what he did.
There we go, sir.
He would go up and he would put his life on the line to save someone. 100, I would never doubt that. He would always put someone before him.
Could you find me a 12-lead extension? Yeah, thank you.
You know, maybe come home with a few cuts and bruises, but nothing that was like that serious. And then goes off to play golf and ends up
Yeah, no problem.
Is that equipment factory around here? Nice.
Just don't faint on me, all right?
I'll try not to.
I need to go and buy a magazine.
Huh?
I need to go and buy a magazine before I pull my own hair out and eat it.
She's got nice legs. I know. I really want a tan. That St Georges has. Is it good? Is it good? It's brilliant. Really? I put it on for 1 hour. I was so brown on the Saturday. Really? You don't look it now? No, I exfoliated it all off this morning. I might get it then.
28-year-old Siobhan has come into A&E after cutting her finger chopping vegetables.
You know when you part-boil the potatoes and you go to put it in the oven? They're boiled, so I thought I'll leave them for 4 minutes and I'll chop the sweet potato. That's when all hell broke loose.
Her twin sister Caroline has accompanied her.
Everyone thinks it's perfectly acceptable at work to say, hello, fatty. You've got an excuse to be fat, though. Oh, she's kicking. To be honest, you look just a little bit chubs today because you're wearing black. At the wedding, I was really mean. Someone came up to me and was like, you're pregnant. I was like, no, I'm not. Why would you say that? I had salad for lunch. I'm never eating again.
Emergency department, can I help?
Bloody tailbone is killing me. Sometimes it feels on fire. Can't you have a massage to make it better? Well, I asked Sam to massage it, but because it's right on the crack of my arse, he's like, I don't want to touch there. I am your wife. You can do this.
It's been 30 minutes since 52-year-old John arrived at St George's, and doctors still don't know the extent of his head injuries.
Total shock, isn't it? Yeah.
Just like come from Rochester as well.
John's wife and their 2 sons have now arrived at the hospital from Kent.
All right, all right.
In my eyes, my dad can do everything. Growing up, when he used to tell us all the stories that he used to do, I thought, yeah, that's my dad. Like, he's going in there, he's rescuing people for a living. And yeah, no, I used to tell everyone. Yeah, he was a good role model. I used to play rugby quite a lot, and he would be there every Sunday, every training session. He would never miss things like that. Play golf together, going down the pub for a drink. We was all really close growing up. We always done loads of stuff together. Whatever he likes, we like. Whatever we like, he likes. He's one of us.
I love it when they have their boys' time together, and I'm quite happy to sit back and just watch them. They're just both really protective of their dad.
When I see him laying there in the hospital bed, there's nothing you can do about it. When he's always been the big, well, brave dad.
Can you call this patient? I can't say that.
Coma.
Oh,
Say
please.
Coma.
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 I can't do it.
Yeah, it's crushed, mate. Yeah, no, it's not looking good. Yeah, all right then, mate.
Siobhan.
Oh, all right, I better go.
I'll come with you. Oh, well, I've gone all this way, you know.
Hello.
Siobhan has come to St George's with her twin sister Caroline after a cooking accident at home.
What have you been doing to yourself?
I was chopping a sweet potato
Okay.
and the knife just slipped. I don't really want to look at it because it makes me feel a bit squeamish.
No problem.
Do you want me to hold your hand, Dave? No, I'm all right, thanks. I'm going to firm it.
Just do a couple of things just to reassure me. So just give a bend of the finger for me. Lovely. And can you feel me touching you?
Yeah.
That side and this side.
Yeah.
Lovely. Yeah. So the good news is it's nothing too serious.
Oh, good.
OK,
Yeah.
so we'll get that
I'm not
clean-
going to lose the finger.
No, not at
Good.
all. I'll just cover it slightly for you so you don't have to look at it.
Siobhan's going to be in the birth with me, so you've got to remember this sympathy I'm showing you. No. When it's other people, it doesn't bother me. When it's myself, I can't cope.
What are you going to be like when you give birth one day?
Oh, I'm just going to... someone knock me out and give me a cesarean. It's made me look like I've got a dirty nail as well.
We'll try and clean it up best we can,
Yeah,
OK?
that'd be lovely. Don't you have any nice shades of red here?
Afraid not.
Silly Billy. No more cutting sweet potato.
The biggest victim for us is avocados.
So avocado's your biggest culprit?
I think it's getting the stone out.
Oh, I've just bought my first avocado from Sainsbury's the other day.
What did you just say?
Avocado.
Avocado.
Avocado, yes.
Avocado.
Avocado.
Oh, hello. What's this?
A tiny little condom on your finger.
Got a condom finger? Hello.
I would say couple of days to,
right.
you know, then take it off and your natural healing will knit the wound together.
Yeah. All right, wicked.
All right.
Thanks for that.
That's no problem.
Thanks for all your help.
Enjoy your evening and be
okay.
careful with the avocado.
I will.
I'll get Sam to cut it in.
Take care, won't you? Bye.
Wake me up before you go. Hello, afternoon, porters.
Aww.
So let's have a look at your x-rays and see what's happened here.
What's that? Oh.
This is your leg.
77-year-old Joan hurt her leg after falling down the stairs at home.
If I push here, it hurts.
No, when you was pushing that bit.
Just there.
None of that.
Emergency nurse practitioner Craig suspects it's broken.
So how if I push here?
No, not up there, just down. I left school as soon as I could. Yeah, just there where your thumb is.
Just there?
Yeah, just that very bit. Because money was sort of badly needed in them days.
What I want you to do, can I get you to kneel on the chair for me?
Yeah.
Put both your legs up and just relax for me.
Yeah. I've worked in a greengrocer's, I've worked in a cafe, I've worked in a peanut factory. You couldn't talk, you couldn't look, because you had 4 ladies walking up and down watching all the time. Whether they was watching if you was eating the nuts or what, I don't know.
Is it painful back here?
No. No, I've never ever liked peanuts. I thought they were horrible.
I think you might have torn your Achilles tendon, you know.
Yeah? What's that then? What's that for?
It's the big tendon.
Tendon, yeah, that's what I thought. I only got about £2 a week, I think it was. So I gave my mum half. So it left me £1 to go through the week to see my mates.
So what we might do is I'm going to arrange a boot for you, and then hopefully it reattaches itself.
I won't wear bare trousers, I'll have to come in a tutu, won't I? You'd go about with these big long umbrellas and big stiletto shoes and pillbox hat. We used to go and sit in the ice cream parlour. Oh, pictures, you know, we used to go up the pictures. How long does that take, do you reckon?
Months to heal.
Months? I met my husband in there. And he said, oh, this one of your sweets, love. Well, I said, not having one of them. He said, go and get your own outside. And it just sort of went from there, you know. I've done it before, mind you, I must say.
Have you?
Yeah, I've done it loads of times. He had lovely hair, Lee, because it was all in the quiffs and the velvet collars and crombie coats and things, yeah. We'll slide down the banisters next time. I'm not going to walk down the stairs. All the boys thought they was Elvis, didn't they?
Soak this with gauze and stick it on a wound that he's got between his eyes. There's a slight lack above the right eyebrow as well.
It's been over an hour since 52-year-old John arrived at St George's.
OK, so the left pupil is responsive.
Head scan results show no obvious sign of brain injury.
So the reason it's blown is it's ocular trauma rather than brain injury.
But doctors won't know how damaged his eye is until they wake him from his induced coma.
Given that, we think his brain is probably OK and that this is probably more an isolated eye injury. Can we try waking him up? Once you've ruled out the worry of an immediate problem with the head, then it was important in his case to wake him up to see what other effects they have and if we could isolate the problem.
Yeah. We'll get that tube out, don't worry, don't worry. You're in hospital, John. You've had an accident on the golf course.
You can't ask them, for example, if they can feel something or to move their arms and legs when they're asleep.
That's it. That's fine. You're doing great.
Oh, no, that was crazy.
Crazy? What was crazy? All of it. Do you want to come in? Come in.
You what? You can't see, mate. That's all right, you've got something up in your eye at the minute. So just try and rest for a minute. He loved his job so much, so the day that he retired, he was like devastated, really. He missed the brigade so much, and It was really tough, to be honest. That was quite a tough year. I just think he felt lost.
Your head hurts. You've had a lot done to you, darling.
He did become a DIY dad. He built his bar down the bottom of the garden. He's built about 4 or 5 different sheds. Built the dog's kennel. And then he found golf.
We've got dinner and dance Saturday night.
We've got barbecue Sunday.
Yeah, family barbecue on Sunday. You do anything to get out of that.
It just was like a new lease of life for him. Yeah, he'd do all the chores indoors. I say to him, he goes, don't leave me a list. And I go, no, I won't, but I will. I'll leave him a list. And once he's done his chores, he can go up the golf course.
Hello again. Do me a favor. Wiggle the toes on this side for me.
Can't open it.
Good. And now this side.
Now your right side.
Can you feel me touching? Wiggle the toes on this foot for me, the right foot. Okay, how about the right foot? No. Wiggle the right fingers. Fingers of your right hand. Good, go on, go on, go on. Can you lift the arm up?
Seeing that he's got this weakness and having no reason for that on the first scan, what we worry about is, why is that there? Certainly the eye injury wouldn't explain having numbness in the arms.
Nearly there, go on.
Is there more to this than we're seeing?
Okay.
Oh, well done.
If I lift it up, can you keep it there? Hold it there, hold it there, hold it there, hold it there.
Is it like a stroke? It's like stroke.
Don't know, it's too early to say.
Yeah, it is.
Strokes can come in 2 formats,
That's all right, don't worry.
where there's a loss of blood supply to the brain, or where there's bleeding on the brain. The bleed is causing pressure on the brain and causing areas of tissue to die.
Oh, don't strain, babe, that's fine. Okay. That's fine, don't worry. That's good. Don't strain no more, don't do it no more now. All right, just take it easy.
I thought he wouldn't be able to cope. I've never seen him in a vulnerable state like he was.
You've got a problem. With what? Your right side.
I felt concerned. Even though we knew he didn't have a bleed on the brain, we wasn't sure what else had happened to him.
Oh, what are you doing? Sitting up?
Oh.
Right, stop moving about now.
Oh, my foot.
Hey?
My foot.
And I just thought, is he going to end up paralysed?
Second one of these I've had already. I have to fill it up again.
I had a brilliant time in Ibiza. I went twice.
Really?
Yeah. Foam park. Oh, it's amazing.
Did you go in season?
Yeah.
Yeah.
Where is your Achilles tendon?
Tendon. If you feel here, feel how tight that is.
Yeah.
Then feel this, it's gone.
Oh, yeah.
I think you've partially ruptured it.
Yeah.
X-rays and examinations show that 77-year-old Joan has torn her Achilles tendon.
Okay, just give me a few minutes, all right?
Yeah, don't rush on, no rush.
Okay.
When I met Lee, my husband, I think I was only about 15. I mean, 3 years I was with him before we got married. His parents weren't very happy because they would be losing his wages, you know what I mean? We had 3 children, 2 boys and the girl. So many people said, oh, that won't last, that won't last. Because we're like chalk and cheese, we're both so different. You know, he likes sport and I don't like no sport. He doesn't like soaps and I love soaps. They were wrong. And we've been married 60 years.
Okay, look at the size of this.
Oh, my God. That's a man's one, isn't it?
It's a medium. I know, it looks massive, doesn't it?
I'll have to see if I've got a boot to match it so it looks a pair.
Keep coming. Do you feel like it's too unstable?
Don't show them, they'll all want boots.
They will want them too. Will you get a factory clinic appointment for her tomorrow, but she doesn't want to be here early?
All right, great.
Okay, take care.
Thanks a lot.
No worries.
Thank you.
Okay.
Oh, it's crazy in here, isn't it?
Yes?
Yeah, so all is good. Just try and rest for a minute. All right, so the boys are here.
You are, Dad?
52-year-old John has been in resus for nearly 3 hours.
Wiggle your feet. Try and move it, babe. Can you do it?
Can you feel me touching your foot?
After being woken from an induced coma, doctors are investigating why he can't move his right arm or leg.
They think he had a right-sided facial hemidroop. So I'm just going to get stroke team to come down and see him.
God, you're a worry. What are you doing?
John, just lift up your arm for me again on this right side. So it's already getting more anti-grav than earlier. Good man, well done. That's fine, that's fine. Relax, relax, that's good. It's already getting better.
After patients have fits, sometimes they look like they have a stroke.
Yeah.
But I'm sure that's what's resulting in that.
Although John is recovering motor function in his right side, doctors will need to do further tests before they know if he'll regain sight in his injured eye.
Because we know now why his pupil's wide open is that the golf club's hit him and he's got an injury there. The ophthalmologists have seen him.
Okay.
They'll see him again tomorrow. You still can't go home tonight.
No.
They still want to see your eye in the morning.
He's always supported me. Why are you such a worry, eh? You know, we do disagree, don't get me wrong, and I'm quite opinionated and I do stand up. And it's normally him that just gives in because he just thinks, I'm not going to win this. So I'll just give in to her. They took your wedding ring off. I bet you told them to, didn't you? To have been together for 31 years, I think we must be getting something right.
I think we are all the result of the people we've met and the interactions we've had in life. You know, seeing my parents stand side by side through everything they've had to survive teaches you the importance that actually you don't need anything else in life. And I think probably it's because they had each other, they had the strength to do it, because it's not really something that you'd embark on alone.
And are you going to give up smoking?
No, I'm not. I would like to really, but I'm not. But yeah, don't tell that doctor up the hospital, will you? Tell him I packed up.
I'm a true believer when your number's up, your number's up. It can be as simple as a thrown golf club that can change your whole life or end it. It wasn't my time. It could have easily been that way, but it wasn't.
I just think if anything's been learnt up there, it's they're not going to throw their clubs anymore. I don't think any of them would dare to do it again.
It was a freak accident. I'm not angry about it, and I'm not bitter about it. It's just one of those things. And it happened. But I'm here to tell the tale, so it's not too sad.
"20 miles per hour cyclist knocked over. He's got a laceration on his forehead."
Everybody reacts to things in a different way.
Jesus.
Human emotion is a very complex thing.
Can you feel me touching your legs? She can't move her legs.
I don't think she will cope with that. People hold on to hope. I know sometimes that I'm taking that away.
I just didn't want to die alone, that's all.